Hello, I am Dr. Priya. I'm an assistant professor at the Texas College of Osteopathic Medicine, University of North Texas Health Science Center, and I am the interim chair of the Department of Pediatrics and Women's Health. I'm a practicing general pediatrician. It's a pretty self-explanatory title. It's the Pediatrics Mental Health Calls Initiative. It's really a student-run program. And essentially, what it is a volunteer opportunity by TCOM and PA students, medical students and PA students, to make outgoing calls utilizing screening tools that we have to reach our patients during this stressful time from the beginning of the pandemic, still going on currently, to reach out, ask pointed questions, have conversations with patients and parents of patients to address their mental health needs. The idea came up during a time when we were really facing the challenges of having to shut things down, change most things to virtual. And for us, as in general peds, we have a lot of what would be called more routine healthcare, well child checks, preventative medicine. But during those visits, we have really important screening tools where a lot of times essential things come up in non-essential visits. And so an initiative began and kind of just really over a couple of days with a student leader who was interested in this as well. We developed a database that had information to make those outgoing calls, a few scripts based on the ages that we were calling, and really made sure that we were completing some of those validated screeners for mental health over the phone when we have patients that couldn't come in person, or maybe weren't coming in person as the pandemic has continued due to either financial constraints, time constraints, or concerns of being safe to come to clinic. So one of the things that we've learned throughout this is that it has been an adaptive process. So, the student volunteers and I meet regularly. We have made adjustments already. So originally we were all about, you're stuck at home, you're having to work from home as parents. How are you doing with that stay-at-home order? And then we realized that families were being impacted directly by COVID. People were losing loved ones, but people were losing jobs. It became a much broader topic. The other thing that came up is that these outgoing calls were just reaching people in a different way. Possibly, or most likely, a lot of these people would have had mental health issues or things they wanted to bring up in the first place, that perhaps the best angle for them was something like an outgoing phone call in their own homes to have this conversation. So to answer your question, I think some of these problems were an issue before the pandemic. I think the pandemic exacerbated certain issues, and I think mental health and addressing mental health will continue to be something very important and part of primary care.